Hi everyone, my name is Darshana. I'm a second year medical student at the University of Toronto. Thanks to the CAP studentship, I had the incredible opportunity to conduct research with Dr. Daphna Gladman, and today I'm excited to share the result of our study, which looked at work productivity and its relationship to clinical features of psoriatic arthritis. So first, to provide some context, psoriatic arthritis, or in short PSA, is an inflammatory musculoskeletal disease that affects up to 30% of patients with psoriasis, causing severe joint damage and significantly impacting their quality of life and work productivity. Decreased work productivity has far-reaching consequences not only for the patient, but also for society as a whole. In the field of medicine, exciting developments have emerged in the form of biologics and Janus kinase, or in short, JAK therapies. And these advanced therapies can slow the progression of the disease, but they're costly and not always available as a first-line treatment. For many chronic conditions like PSA, early intervention and management are crucial to minimize their impact on work productivity. Unfortunately, too often, by the time the effects on work are noticeable, it becomes challenging to reverse the disease. This is where our study comes in. Our project aimed to investigate the relationship between work productivity, clinical features of PSA, and the type of treatment received to determine if early intervention with biologics and/or JAKs has the potential to reduce work impairment. To achieve this, we collaborated with PSA patients at the Toronto Western Hospital. During their routine clinic visits, we asked them to complete the Work Productivity and Activity Impairment Questionnaire, or in short, the WPAI questionnaire. It is a validated tool that measures impairments in both paid work and daily activities. We also used various clinical assessments of disease activity and damage, as well as x-rays, to gauge the severity of the disease. From May to August 2023, a total of 113 patients participated in the study. 53% of these participants were employed, 58% were male, and their average age was 61 years. We found significant associations between various PSA clinical features and WPAI outcomes. More specifically, there was a strong correlation between the amount of work time missed due to PSA and several key measures, including the Clinical Disease Activity Index, the Health Assessment Questionnaire, Patient Pain Assessment, Patient Skin and Joint Activity Assessment, Physician Global Assessment, Physician Joint Assessment, and Physician Skin Joint Assessment. Similarly, we found these associations in relation to the amount of impairment experienced while working, overall work impairment and activity impairment. However, there were variations in the results when it came to the physician assessments, with the physician global assessment being the primary measure that was significantly associated with work impairment. We also found that tender joint count, swollen joint count, and actively inflamed joint count were significantly associated with activity impairment that was not related to work. But what's even more exciting is that patients treated with biologics or JAKs had a significant reduction in the percentage of impairment while working compared to those without such treatments. And so this means that advanced therapies has the potential to be a game changer for these patients. So to sum it up, we found that clinical features of PSA, specifically disease activity, is significantly associated with work impairment. And interestingly, the damage caused by PSA, whether it's assessed clinically or radiologically, doesn't appear to be significantly linked to work productivity. And so this highlights the importance of effectively managing disease activity to enhance work-related outcomes. Our study also showed the effectiveness of biologics and JAK therapies to reduce work-related impairment. Future research should delve into these treatments to understand how we can improve work productivity and overall quality of life for PSA patients. Once again, I want to thank Dr. Daphne Gladman, my supervisor, as well as the Canadian Association of Psoriasis Patients for supporting this project throughout the summer. It has been an incredible experience and really provided me with valuable opportunities for learning and mentorship. So thank you for the studentship. And if you have any questions or would like to learn more, please feel free to reach out. And thank you for listening.